There is a statement, my friend Tahir plays cricket but prefer hockey more. My friend Tahir plays cricket but prefer hockey more. So this is your one sentence sizes, this is your other sentence sizes. We are memorizing the etiology of the maxillary midline diastema, starting from the midline, moving toward the central and then lateral. M start for mesiodens. Obviously, it will be found in the middle of the tooth. F stand for frenum. T stand for tumour. What I mean to say that in the mid of the two sentence sizes, there could be frenum, there could be a supernumerary tooth like mesiodens, there could be any pathology like tumour or cyst. So mnemonics is MFT, my friend Tahir. M stand for mesiodens, F stand for the frenum, T stand for tumour. Place, P stand for pathological. Now we coming to the sentence sizes. In the sentence sizes, you could have pathological tooth migration. So P stand for pathological tooth migration. Plays cricket. Then we talk about the crown to root angulation. Then stand for bracket positioning. We discussed in the last clip. My friend Tahir plays cricket but. So far we have discussed any mesiodens, M stand for mesiodens in between the sentence sizes, any frenum between the sentence sizes, any tumour between the sentence sizes, tumour study pathology. P stand for pathological tooth migration of the sentence sizes, flaring of the sentence sizes caused crown to root angulation problems. B stand for bracket positioning error, can cause diastema, but prefer. P stand for palatal. Now if you see, we discussed all the etiology of the midline, then we come on the central sizes, then we are coming on the lateral sizes. So the palatal is etiological factor because if it's diminished size, the central sizes move into this place and can be caused by diastema. So P stand for palatal. The H stand for hypodontia. If the lateral incisor is congenitally missing, obviously the central incisor move into this place and you would have a gap between the central incisors. So H stand for hypodontia and M stand for microdontia. If there is a generalized small size of the arch, then you would have the gap between the central incisors. So my friend Tahir plays cricket but prefer hockey more. M stand for mesiodens, F stand for frenum, T stand for tumour, P stand for pathological tooth migration, C stand for crown to root angulation problem, B stand for bracket positioning error, P stand for palatal. Now we coming to the lateral incisors. H stand for hypodontia of the lateral incisors and M stand for microdontia of the dentation. So there is 1, 2, 3, 4, 5, 6, 7, 8, 9 causes of the midline diastema. Then after these 9 causes, you have to memorize the mnemonics H, R, HERT. There are many departments in an organization, and which department is more lethal, which detect the salaries, HR department. So HR heard, HR department heard. So H stand for, let me create spaces. Now we have lost the rhythm. We started the rhythm from the central, in between the central incisors, then we come to the central incisors, then we come to the lateral incisors. Now we are out of the rhythm and we are away from this. H stand for the habits, and the habits can be thumb sucking, mouth breathing, tongue thrusting, tongue thrusting, or macroglossia. Macroglossia is actually not the habit, but increased size of the tongue. I have combined it the symbol way because of the similar mode of action. Then this R stand for rapid palatal expansion. Then the rapid palatal expansion, you develop the transient diastema that must not be treated. Okay. Then this H stand for hereditary predisposition. U stand for ugly duckling stage. R stand for racial predisposition. Racial predisposition means certain Negroes would have more problem, and T stand for trauma. So the mnemonics would be: my friend Tahir plays cricket but prefer hockey more. Mesiodens, frenum, tumour, pathological tooth migration, crown to root ratio, bracket positioning error, peg lateral, hypodontia, microdontia, habits, rapid palatal expansion, hereditary causes, ugly duckling stage, racial predisposition, and dental alveolar trauma. And